Hi, my name's Justine. I'm going to go first in this panel session. So we're all vets working in different areas and vet nurses. So we're going to talk a bit about our careers, how we got to where we've got to, why we decided to go into where we've gone into, and just give some advice, and then really answer any of the questions that you have for each of us. Again, you might have questions related to generally getting into the veterinary and veterinary nursing careers, but also how we've got to our particular niche jobs. So for me, I am the veterinary services manager at Marwell Zoo in Hampshire, which is a large zoo, quite a safari park feel, but we are a zoo, so we walk around it rather than driving around it. And I've been there for the last 5 years, leading the vet team for the last 3 years there now. Okay, next slide, please. Thank you. So I, like a lot of vets, have always dreamed of being a vet since I was very young. I worked really hard through school. I tried to study sciences as far as I possibly could and get involved in all of aspects of work experience. So I did work experience on farms. I got a Saturday job at a vet's. I did as much as I possibly could to have lots of pets, campaigning with my parents because I really loved animals and I was really passionate about it. And it does really take quite a lot of hard work and dedication because it is very competitive, but you can definitely, if it's something you care about, you can definitely do it and get there if you put your mind to it. I also spent a summer working in a genetics lab to get some experience of research, and bred my dog and had puppies with my dog and that sort of thing. So lots of animal experience, working really hard at school, and I was really lucky to get a place at Bristol. So I went to Bristol University. During my time there, I also did a sandwich year in veterinary pathology at the London Vet School as well, the Royal Vet College. And towards the end of my university, we had the option to choose an elective, which is a period of our studies where we can focus on one particular area of practice, and I chose Bristol Zoo. So that gave me a taste of zoo work. I'd always loved all aspects of veterinary medicine, so I wanted to work with domestic animals, but also I had a long-term goal of working with wildlife, either in some conservation context or with maybe wildlife in a zoo or safari park as well. But I think it's really important to get your clinical skills in working with clients and their animals in normal domestic practice, because really you see high volumes of cases and you can build your confidence, get to have experience of different surgeries, etc., before you then go on to work with some of the more exotic animals. So I worked for 5 years in mixed practice. But before I got that job, I did spend a summer traveling around South and Central America with some friends from vet school. And we volunteered, for example, in a sea turtle project and also in a wildlife rehab centre in the jungle. So we got to use our veterinary skills, volunteering and helping these animals that had been confiscated from the illegal pet trade, etc. During my time in mixed practice then, I built up my skills. I had experience of working with farm animals, with horses, with pets. I volunteered to look after some of the more exotic domestic animals. So we had clients with alpacas and a little local wildlife park that had lemurs. So I had a little bit of a flavour of what zoo vetting would be like working with those animals. And I saved up and managed to get a place on the Masters, which was in wild animal health, which is really one of the ways that you can get into zoo veterinary work. I was extremely lucky on my Masters in that I got a project working with wild cheetahs in Botswana. So we got to go out there, trap wild cheetahs, which was a real amazing experience, and then put collars on them, tracking collars, to see where they went and how they interacted in farmlands and predated cattle, or how they interacted with the wildlife there. So that was wonderful, and it really inspiring to work with wild animals in the wild as well. I then continued working in London. I got a part-time job at London Zoo and worked on sort of disease risks around native British species and reintroductions of some species that had been diminished or suffering. So often these would be small frogs, invertebrates, bees, spiders, this sort of thing, but also very important for conservation and the ecosystem in the UK. And then the job at Marwell Zoo came up, and I was really lucky again in that I got that job, and I've been there ever since. Next slide, please. Thank you. So what's it like to be a zoo vet? Well, it is quite different from a vet in practice. So my life is very different from the sort of consultation work or the farm calls that I used to do. So we do clinical work, but it's much less than in practice. So we do maybe a couple of anesthesias a week rather than 3 or 4 per day. There's a heavy focus on preventative medicine, so we're really quite hands off. We try and get animals at peak health and prevent any problems rather than treat them. They also don't have the problems of maybe pet dogs are running through barbed wire, and they don't really get those sort of traumatic injuries. They don't have production diseases that some of our farm animals have, or injuries from eventing like horses might have. So they're in a fairly controlled, safe environment, but we really want to maximise their positive welfare during the time in the zoo. So we focus a lot on maximising their health and welfare, and really preventing problems rather than treating them. So it's quite a different approach. We do quite a lot of import and export testing. So these animals in sort of good conservation-based zoos are not owned by the zoos, but they're part of international breeding programs for conservation. So they are occasionally transported around the country or even the world for breeding programs, so that if that species does go extinct in the wild, then zoos have populations that they can reintroduce. There's some research work. There's, for me now, managerial work and practice management as well. So quite a lot of admin. There are quite a few meetings, so it's very desk-based compared to a vet in practice. But we also get to teach students around wildlife and exotic animals as well. So that's quite exciting too. Next slide, please. Thank you. So just a few pros and cons. So I know you're going to be at the beginning of your careers, but just things to think about for the future if you're interested in wildlife and zoo work. So there's an amazing array of pros. Obviously, you get to work with amazing animals, really interesting cases. Really get your hands on working with these animals is a real privilege, and you are part of a bigger picture of conservation too. There's this focus on preventative medicine, so you can make a difference to their lives and keep them healthy. You can positively improve their welfare. So I think vets' positions in zoos are really important for maximising their physical and psychological health of those animals and giving them the best life you possibly can. You get to contribute to conservation and research. We have been involved in reintroduction programs of, for example, scimitar horned oryx, which are these beautiful oryx species that were completely extinct in the wild, and internationally zoos have collaborated to reintroduce, and they're now back in the wild breeding, which is a fantastic success story for zoos. So that's really rewarding. You get to be involved in progressions like animal training, enrichment, enclosure design, so making sure you're giving the new builds the best possible aspects for those animals' lives, and lecturing and teaching students as well is great. Some of the cons, again, compared to practice, just be aware that generally with conservation work, wildlife doesn't have a lot of funds behind it, so the salaries do tend to be significantly lower than private practice. You tend to have high levels of responsibility, often working in quite small teams. There is quite a lot of admin and paperwork, so if you're much more practical minded, you might prefer a life in practice with domestic species. And it can be quite dangerous because you are working with dangerous animals and dangerous pharmaceuticals as well. And there are, as with any other aspect of veterinary medicine, ethical dilemmas. So talking about quality of life for geriatric animals, whether you should be breeding these animals, what you do with the offspring, if you have room for them, etc. So lots of things to think about. And these are really challenging, but good to discuss on a wide basis in your team. Next slide, please. So just to finish up from me, I think if you're keen on being a vet and interested in wildlife and conservation, just concentrate on getting into vet school to start with. It's an amazing career. There's lots of different opportunities you can go into. There's also many different opportunities in the conservation field if you don't end up wanting to be a vet or a vet nurse, a conservationist, biologist, behaviourist, etc. In my team at work, we've got nutritionists who aren't vets. We've got a behaviourist who does all of the training as well. So lots of options there too. work hard, try and get as much work experience as you can. Try and talk to people who work in the fields that you're really interested in. Maybe get a Saturday job or volunteer at a vet's. That will all stand you in good stead for vet school. And then if you're really keen on wildlife and zoo work, make sure, I would say, always get your grounding in domestic species first, so you are sort of a good vet before you then have to operate on a giraffe or something. Always look out for opportunities that come up. Yes, it's a competitive field, but there's more and more opportunities, and if you're really passionate about it, just keep trying and you will get there eventually. And that's pretty much it from me until question time. Thank you.
So, hi everyone, my name is Mandisa Greene. I am a small animal vet, and like Justine and Jack, I think you have to have a love of animals to be in this field, but really important is that you have to have a love of people as well. So a bit about my story. So I'm a small animal vet. I graduated from the University of Edinburgh over 10 years ago now. I started off really wanting to be a vet from a very young age, and I I tried to get into vet school the first time round, but that didn't work out. I didn't get in, so I decided to do a degree instead. So I got the A levels that I needed, or got adequate A levels, but they weren't. I didn't get into vet school, so instead I went to do a degree. Whilst I was doing that degree, I got loads more work experience. So I went from a small animal vet to a large animal vet. I did race horses, farm animals, everything that I could think of, to get me some more experience. And once I had really good experience, I applied again to vet school at the end of my degree, and I got in. So I went to Edinburgh University and did a degree and graduated from there. I'm also, the picture on with the gown is me in a gown, because I'm also at the moment the president of the Royal College of Veterinary Surgeons, which is the regulatory body, so the body that makes the rules, I guess, for want of a better phrase, for vets and vet nurses in the UK. So yeah, go to my next slide. So what I do. So on an average day, I see mainly cats and dogs, and it can vary anywhere from little kittens to really older cats, and it can vary from puppies to really older dogs. I think too, it can vary from very healthy animals to very poorly ones. So on an average day, I will see healthy animals who are just coming in for their annual vaccinations to try to keep them healthy and make sure they don't succumb to any diseases. And I can also see ones who just recently got sick, so they got sick yesterday or the day before, and I can see ones who have illnesses that they will have for their lives, so lifelong illnesses, and that can be anything from things like diabetes, which we also have in humans, to things like hypothyroid problems in cats, and where they have an overgrowth of their thyroid. And so it's very variable what I will see on any given day, which I think is part of the fun of the job. You can never go into the practice and think to yourself, I know what's going to come today. It's always going to be something different. So on that vein, I also treat rabbits and what we would call exotic animals. So they can be anything from a hamster to a guinea pig to a chinchilla or a rat. And so they're also classed under the small animal bracket. There are some vets that treat only exotic animals. And so they would be generally a specialist type of exotic vet. But in my job as a small animal vet, people sometimes sometimes don't have access to exotic pets, exotic specialist vets, and so they will come to a small animal vet for treatment for their little small furries as well. And so that's always an exciting part of the day. And again, it can be anywhere from a really healthy animal just needing a bit of a checkup to an animal that's poorly and recently got sick to an animal that's got something that's going to need a lot more treatment for a longer period of time. Okay. So how I chose this section of veterinary science, so it's small animals. I chose this sector really by default. I think I always wanted to be a vet. I always had pets. I always knew that I wanted to treat my pets. And so it was kind of what I knew I was going to do. When I got to vet school, or even in the experience before, I started to be around horses and cows and pigs and other animals, and I just thought, wow, it was so amazing. I'd never been around that many animals, and I didn't know whether what I wanted to do at the end. So I went through my entire career vet school changing every 5 minutes what I wanted to do, and kind of upon graduation I thought, definitely. So the year before I graduated, I thought I was going to be a horse vet, and I was focused on that for a good year. And then the year I graduated, I thought I'm definitely going to be a farm vet, and I focused on that for my whole final year. And I thought, that's it, I'm going to do it. When I graduated, the practice that I used to see some of my work experience in offered me a job, and that was a small animal vet. And so I graduated on the Friday and I started work on the Saturday in a small animal vet. And I really, really just loved it. And I think now, regardless of which path I chose, so regardless of whether I went with the horses or with the cows or with the or if I went into zoo animals, I think I would have still loved it regardless. I think it's just the animals and the simplicity of being able to treat an animal when they're really poorly that I loved. So I chose small animal by default because that was the job I got, and I stayed in it. I did some emergency work as well. And so for about 5 years, I did emergency work in small animal, which means that I was able to treat small animal pets who were really sick, but in the night times and on weekends and holidays. And I really loved that. It was really good because it was, one, very flexible. So I could do other things in the daytime when everyone was at work. And in the nighttime, I would get to go to work. And it was really nice because it was very you get to see the sickest animals, but you usually get to treat them as well, and so it was almost like being in an emergency room. It was very quick paced, it was very detailed medicine, very critical medicine, and you had to be on your game all the time, which I really, really loved. So I did that for about 5 years, and then I went back into small animal because that was when you don't get to make friends with the clients because everybody comes in and they're really upset, and they're rightly so, and their animals are really stressed and they don't want to be friends with you. They want you to fix their pets. Whereas when you're in the small animal practice and you're helping healthy animals, you get to build relationships with people. They get to tell you about their holidays and their grandchildren, and it's a much more relaxed experience than when you do emergency work. So I went back into small animal, and I stayed there. So I stayed there so that I wanted to build relationships with clients a bit more. So I think that also covers my last slide, which is how I got into this sector. Very much, I think for building relationships with clients, I like to talk a lot. I like people a lot. And I think that was the thing that fed me, as well as being with animals. I was able to speak to people and build relationships. And that was what made me happy on a daily basis. In terms of any advice, I think certainly I would say there are a couple things. One, you need to get all the information that you need. So you need to do some research if you want to go into vet school. Research everything that you need to know, and what you'd need to do a successful application. Also reach out. There are lots of people out there who can help you and who can give you some advice and mentor you through your application process. So reach out to people now on social media or whatever and get some help, and be really, really determined. I won't be the first person, and I'm not the first, and I won't be the last to have to take another route to vet school. And even if vet school, you're not sure if you want to be a vet or whatever you decide you want to do, it may be that you don't get there the first time, but be really, really determined to get where you want to go. I think it's really important to hold on to your dream and to fix on it, and to make sure that even if people on the outside are telling you can't do it, or that you're not bright enough, or that you haven't got enough experience, or whatever they tell you, you can still do it if you are really, really determined. In my experience, determination is one of the main things you need to succeed in this profession and in the professions. Thank you very much.
Hi everyone, so I'm a registered veterinary nurse and I qualified in 2018, so only 2 years ago. I now work in a 24-hour hospital based in Norfolk, and it's an emergency critical care setting like Mandisa mentioned earlier, so it's quite a high pressured environment. They often come in very, very sick. We cover about 28 practices out of hours in the local area, so it's quite busy as well, so I do really enjoy it. I'm also a member of the British Veterinary Nursing Association's Vet Nurse Council, which is the voice of veterinary nursing. So it involves working with many other veterinary organisations such as the RCVS and also the BVNA and many more as well. I have interest in ultrasound, anaesthesia, exotics and emergency and critical care. I'm due to start my certificate in emergency and critical care in October to sort of gain further knowledge on it and expand my horizons. I'm hugely passionate about promoting the role of vet nurses and what we can do in practice as well, in sort of making higher job satisfaction, increasing the retention of veterinary nurses in practice as well. Next slide, please. So what do veterinary nurses do? Veterinary nurses, an extremely rewarding career path, in my opinion. We work at the front line, having an impact on animal health and patient care, and it's something that really makes a difference, and you're able to see the difference for yourself as well. The tasks include things such as monitoring anaesthesia, carrying out nurse consultations, nursing the sick hospitalised patients, carrying out diagnostic tests and preparing animals for surgery, and also minor surgical procedures within the code of conduct as an RVN. There's also many other tasks, as you can see, sort of that's just a short number of tasks that we do carry out. There's various other ones that don't ever stop. So yeah, next slide, please. So as a vet nurse as well, we can carry out further skills and learn new things. So in any medical profession, I think it's a frequent occurrence that knowledge and research is always updated and is constantly evolving. So as an RVN, we have to carry out 15 hours of continued professional development every year. And there's also post-qualification certificates, like I mentioned earlier, such as my emergency and critical care one that I will be carrying out from October. And just in the PowerPoint, there's a slide where I have just started to do ultrasound examinations at work after carrying out a CPD day last year. So it just goes to show that you can put into practice what you learn at these CPD days as well. And now I can carry it out with a fairly high level of confidence as well, which is has a good impact on patient care and animal welfare in practice as well. Next slide, please. So why I chose veterinary nursing. So I chose veterinary nursing because it's an exciting and forever evolving career path. The reward and moments of having a positive impact on your patients that you see is the best feeling ever, really. Obviously, everything doesn't always go to plan. It can be quite difficult, but it's always for the best interest of the animal, wherever we do. So having a voice for the patients enables us to make that positive change within their patient care as well. So that's one of the most rewarding parts as well, being able to take place. And also the doors that open when you qualify as an RVN. So there are so many different opportunities. It's not working in clinical practice necessarily. There's many, many different options to go for as well. And like Mandisa touched on earlier, no day is the same. We do not know what is going to walk through the door, which I would say is very exciting. When we get a phone call, we never know what's going to be on the other end of the phone, whether it's a baby deer or a snake or anything can come through the door. Next slide, please. So there are a few different ways to pursue a career in veterinary nursing. So I personally done the level 3 diploma, which was a work-based apprenticeship style course. But there is also the degree route taken up with the universities as well. So you just have to complete a practical progress log as you go through. I'd say a massive important thing in pursuing your career in vet nursing is work experience. So once you've got that work experience under your belt, it then opens a lot of doors, and everyone knows everyone. So it helps you sort of get into a training practice. But I would recommend researching the pathways to achieve becoming an RVN as well. So you can check out the BVNA website below, and also the RCVS website for different options in how to go for it. And it is a career choice for all. So it is a heavy dominated female profession. So it's a bit unusual to see a male vet nurse sometimes. So I think we make up about 3% of the register, but it is a career choice for all. So don't be afraid and just go for it. And next slide, please. So there's just a few tips below for getting involved in veterinary nursing. So work experience, as I touched on earlier, is invaluable to give you an insight as to what is really involved in a veterinary practice. It's not all cuddling puppies and kittens, ironically, even though my photos may suggest that. We never know what's going to come in. Sometimes it is quite an upsetting environment to be part of, but again, it's very rewarding when it turns out well. So just apply for work experience as much as you can. So don't give up when you get rejected at the first hurdle. There are other pathways as well. So my journey to being an RVN was not straightforward whatsoever. There was lots of bumps in the road, but you can get there as well. So speak to local colleges and course providers as well to find out your entry requirements, and ask questions and be prepared to learn, and don't be afraid to ask what is going on. And then the biggest thing is this perseverance as well. So yeah, and that is my presentation. Thank you very much. Tried to whiz through it. So
did you want to do some questions at the end? There are
time for it.
If anyone has any questions, please feel free to put on the chat, and I'm sure someone will be able to answer those for you.
Just trying to see if there was any. Someone asked Mandisa, what is the other degree that you did before veterinary medicine?
Yeah, I typed it in on the side. So the other degree I did was called biological and medicinal chemistry. Big words, all to say biochemistry, basically. Biochemistry and pharmacology mixed together. So I wanted a science-based degree. I wanted to do something that would help me get into vet school and show that I was able to do a science degree. So I went for that one. So that's what I did.
See, Daniela has just asked the difference between the degree route and the apprenticeship routes into nursing. So I personally done the level 3 diploma in nursing because I wanted to learn more on the job. I'm much more of a practical learner. So being in practice, I got to see everything that I was putting into place as I was learning going through the college. So I worked 4 days a week and 1 day a week in college, learning the theory side of things and doing exams, and a practical log all the way through as well with a clinical coach. And I think the degree route, obviously you get your degree at the end of it. And I think you go off on work placements throughout the degree to achieve the practical steps in going forward. But both obviously open the doorway to becoming an RVN, and it's just down to personal preference, I believe, in terms of what people really want out of it. Obviously, when you do the degree route, it opens up further more doors if you want to do some further university qualifications and such as well. Yeah.
Can I just ask a question? Yeah. So while we're waiting, so I know for Jack and I, we both said our day is very unpredictable. We don't know what's going to walk through the door, and it's very different. But Justine, your clients, your patients, you know them all because they're there every day. So what brings the variation in your day?
Yeah, I guess we have a few things planned every week. So either something like pre-export health checks, so you might need to take a blood sample for a disease test, or x-ray an animal to show that it's completely healthy, etc. But we still do have emergencies occasionally. So we'll have, you know, a bird that looks a bit poorly, or occasionally if, you know, in groups of primates, they might have a scuffle between them, and you have to deal with that sort of thing. So on the whole, it's much less frequent that we have to drop everything and run and deal with an emergency like we would in practice, particularly in emergency practice. But there is still that element of you're not quite sure what to expect. And I guess it's very varied from day to day. So one day I might be teaching the students from Surrey doing a workshop. Another day I might be anaesthetizing a tiger. The next day I might be body condition scoring a herd of oryx or something. So I guess it's just a different range of types of work. So every day is different, but it's more predictable than in practice, I would say, on the whole. So, yeah.
Got one for Jack as well, if I got time.
Go for it.
Okay, so when you decided to do ultrasound sonography, like what have you did a course and you said you're doing some of it at the WIC now. So is it routine stuff, as in you're looking to see if something's pregnant or not, or do you do kind of emergency ultrasonography?
So it's more emergency because I only ever work nights. I don't do any daytimes. So I'm a bit tired during the day sometimes. Yeah, so it ranges between sort of the POCUS scans and the APAS and TPAS scans to check for any free fluid. So it's usually used in a triage sense from my point of view, because obviously not being able to diagnose anything. But if we see a patient that comes in that I think may have a bleed potentially inside, then I can scan it as a triage tool and sort of fast track it through and get the vet on the case quicker if we've sort of got a lot of appointments in. Also post surgery, just to check for any abdominal fluid scoring as well. So if they've been flushed out after a surgery, just to keep an eye on whether that is reducing and not getting any bigger. And then obviously during the night is also when everyone gives birth. So we tend to get all the cesarean sections. So just checking the puppy's heart rates as well to make sure we don't need to go in, and just to check that everything's going okay in that sense. So yeah.
Wow.
All right, okay. I'm
you.
sorry, that's all we've got time for today. Thank you so much. Your talk was really interesting. Is there anything else you wanted to say quickly before you went?
Just congratulations to Mandisa for becoming RCVS president recently as well. That's a big achievement.
Thank you.
Yeah, and just good luck to everyone listening in that wants a career in these fields. It's really rewarding, it's challenging, but yeah, it's a great place to work. So.
Absolutely.
Thank you.